Good evening, Dr. Godkin. This is Tyler Parker from your MFT 8115 class, Addiction and Family Therapy. So today we're going to cover adult addiction, and more particularly how adult addiction is different than adolescent addiction, which is what we talked about last week. So let's go ahead and get into it. So some of the challenges that adults face when they have substance use disorders and undergo subsequent treatment are the increased responsibility that they have as adults, especially if they're primary caregivers for children. Child rearing, as I just talked about a little bit, when they're responsible for another life, obviously there's some additional challenges there and not a lot of whole room for error. Financial and social stability. So when an adult has a substance use disorder, there is the possibility, of course, that they will not abide by their financial obligations and also their social obligations as parents if they are parents. But additionally, if they are not parents, they still, as adults, have, I guess, a little less room for error than adolescents do, which is a huge difference between adolescents and adults, but we'll get into that one in a little bit. Socioeconomic and cultural concerns. So depending on where an adult lies on the continuum of socioeconomic status, they're going to have some additional challenges, but also some additional opportunities as well, depending on what culture they belong to. So yet again, there's also going to be cultural concerns depending on what culture and ethnicity the adult is who has the substance use disorder. They're going to be going through different things and be affected by substance use disorder a little bit differently. And kind of, as per usual, if you are a minority and you have a substance use disorder, it's always, a little bit harder. But at the same time, there are some things that can help mitigate that, such as religiosity or being married. But we'll talk a little bit more about that later. Okay, so social functioning. A lack of proper social functioning by adolescents have negative effects mitigated by parental presence. So again, circling back to the story about Laura, she obviously was making a whole host of mistakes in her life when it comes to substance use disorder and social functioning, but she did have that parental net that was keeping her, that safety net that was keeping her from hitting rock bottom, even though the things that she was doing as she was an adult just by herself, she probably would not have survived those situations or had anywhere else to go that wasn't a social safety net provided by, community supports or anyone else. No such mitigation exists for adults. So if an adult is in a situation like Laura, I guess, but she doesn't have a home to run back to, very likely she's going to end up in a pretty dire situation, homelessness or, financial instability or, a whole host of other things that really can't be helped if she doesn't have that network of support underneath them or underneath her. Child rearing. So adolescents, unless they're parents themselves, are not primary caregivers. As such, there are decreased risks for SUD and mental health disorders that go untreated. So adolescents, rather than adults, adolescents, if they have no children, if they are undergoing a whole host of problems with substance use disorder, I'm not saying that's okay, but I am saying that that is less bad than if they had children themselves, because if they were primary caregivers themselves, they would have someone else who are going to suffer the consequences for the things that they do. Now, if an adult has a child, of course, the child's going to suffer some of the consequences, and they're going to have absolutely nothing that they can do about that. So the child is kind of going to be at the mercy of the parent's substance use disorder, and the adult is going to just basically do whatever they're going to do, and the child is going to have to suffer the consequences. So that is definitely a huge difference. Psychosocial development along the continuum. So an individual's position along the continuum of life development has an effect on treatment outcomes, especially when it comes to age, for whatever reasons that there are. It's been noted that people who are 65 and older do not seek out or respond to treatment the same as people who are 65 and under. So we'll get into that in just a second as well. So adolescence, if a child undergoes treatment for a substance use disorder in adolescence, there's an opportunity to forge new ideals and identities during the formative years of development. So I really was impressed by Laura in last week's video that we had to watch about how she had ingrained some of the ideas that she had from her 12-step program into her new personal identity. I think that part of that may have been because she was undergoing that sort of treatment, or she had that community network during her formative years, so that when she was crafting her new identity after having the substance use disorder and all the things that had happened to her, she was able to integrate those new ideas a whole lot easier. I think for adults, after their identity has pretty much been formed and they know what their ideals are and things like that, it may be a little bit harder for them to incorporate new ideas. I'm not saying that that's impossible, but I am saying that definitely adolescents have the added advantage of being so malleable during that time of their life than adults sometimes, we know, can be, I don't want to say obstinate, but I'm going to say that. There's the better word out there, but sometimes it's hard to change the way that adults perceive things from, their innermost personality. But anyway, adults over the age of 65 do not seek treatment as often as those below 65. So that's kind of what I was talking about a little bit earlier. Adults who are above 65 years old have passed this certain threshold to where they do not perceive the need for treatment as much as people who are below the age of 65. They also do not benefit to the same degree from treatment as those under 65 for whatever reasons. Those were not completely elucidated in the research, but it was noted that is a pretty clear demarcation between who is and who is not going to seek and benefit the most from treatment. So treatment benefits are about the same for all others below 65 years of age, but I should be specific that only was really talking about those around, I think, 30 to 65 years old, because that's kind of what they were pointing to inside the research. So depending on the age you are going to have a different mindset about substance use disorder treatment, and also be able to get a different treatment outcome based on that. That's just on your age cohort. So gender and socioeconomic status, these two variables cause for a differing effect on an individual's substance use disorder and subsequent treatment response. So men and women differ in a number of ways. One of those ways is how they respond to substance use disorder treatment, especially when it comes to pharmacological intervention with cocaine. But we'll get into some of those differences in just a second. So gender, I really did not want to focus on how women are different than men, but I wasn't sure how to present this idea without coming across that way. So anyways, women typically begin using substances later than men. So that's just talking about substance use onset, and that women typically start using substances at later ages than men do. Women use substances less than men, but report the same level of dysfunction. So I don't necessarily know why that is, but, for alcohol, for example, I know that physiologically it takes less alcohol to cause a woman to be drunk, regardless of weight and things like that. So I don't know if maybe some of those physiological differences make a difference there, or, what the case may be, but yeah, regardless, it is typically reported that women use substances less than men do, but they still report the same levels of dysfunction. With pharmacological intervention and cocaine substance use treatment, women respond less with administered medication. For whatever reasons, those reasons were not exactly elucidated in the research, but it was shown that when given medication to help with cocaine use and withdrawal and a part of the treatment plan, there was a lot less treatment responsiveness on the part of women based on, their gender or whatever else factors are involved in that. So socioeconomic status, so lower SES means limited access to substance use disorder treatment options. Surprised but not really, that has to do with insurance and the availability of treatment options. So if you have good insurance, or your income is high enough that you can afford to acquire better insurance, you're going to have more treatment options. So we talked about a few weeks ago about the availability of treatment options kind of determines whether you think that you may need insurance or treatment in total. And pretty much the summation of that research was that if you do not have access to insurance, then you think that you need it more. Obviously, you're deprived in that area and you are perceiving that there is some deprivation there. So increasing education does not have a mitigating effect on substance use. So that was screened across different ethnicities. And the reason that the research pointed to was roundabouts, because if you have greater education, then you have more permissive attitudes towards substance use. But that, of course, is just a supposition. There could be something deeper, but that was one of the reasons that was stated in the research. Okay, so in total, yeah, there are quite a few differences between adolescents and adults when it comes to substance use disorders and treatment, when it comes to treatment responsiveness and things like that. And so as a clinician, it's important to take those things into consideration when you think about what kinds of treatment to provide, what kinds of treatment to recommend, and as a provider of treatment, to be thinking about the different factors involved in a person's ability to acquire the best outcome from the treatment provided, whether that be age, whether that be socioeconomic status, whether that be ethnicity, whether that be gender, whether that be marital status, religiosity, whatever, whether they're religious or not, and the other factors that are involved in how treatment outcomes are empirically tied to a person's status or position on a certain one of those different scales or one of those different continuums. Okay, so yeah, that's just about it. So the references that I used from to come up with what I did are provided right here. I essentially used every one of the bits of research that was provided, because they were all extremely important in coming up with the conclusions that I did. Okay, so yeah, I feel like I'm actually missing something. Yeah, so I am missing something. Right, so one of the things that I wanted to touch on when it comes to gender was from the last bit of research. I'm so glad that I went to that reference slide so I can include this information. It was in terms of fatherhood. So it was determined that fatherhood was not a predictor for better treatment outcomes for males, but fatherhood kind of didn't have much of an effect at all when it comes to like treatment outcomes. So the critical factor that comes to whether a father is going to have like better outcomes with substance use disorder treatment was if they had a comorbid PTSD or other psychological dysfunction. So, when it comes to men, that is a difference that men have. There's not a lot of research that talks about the differences. I remember now because I didn't want to talk about women because I had this other point, but I did not include it in the slide. That men in their parental involvement or child rearing are not much swayed by whether they are a father or are not a father. So if someone is a father, that doesn't mean that they're gonna, see treatment as a better option and respond better to treatment. And if they are a father, it doesn't make any difference. The only mitigating factor is really if they have that comorbid psychological condition, especially PTSD, because that was talked about in the research. Okay, so that right there wraps it up. Okay, and I'm feeling a lot better about that, knowing that I covered what I did not initially mention. Okay, so yeah, thank you very much for your time. I appreciate it. Have a nice night.